Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Hi, Julie.
Hi, how are you?
I'm doing okay. Now, nationally, the numbers are not great. The cases went up at least 5% in 36 states. Let's talk about how we're doing here locally.
Well, locally right now, our cases are actually down a little bit. We have a total of 5,288, but 315 right now are active cases, 4 hospitalized, and of course, since the last I spoke with you, we've had several deaths, so we're up to 27 deaths. Total testing has been at 628,514 for our region, or I'm sorry, for Champaign County, and then our region, which is the 21 counties called Region 6 in East Central Illinois, our positivity rate right now is at 7.2. If we have 3 days of positivity in our region over 8%, things will shut down. We will go into mitigation.
Once somebody is diagnosed with COVID, how long until they can be interactive with other people? Is it while you're still symptomatic, or is there a certain amount of time because the CDC keeps changing this amount?
Yeah, so if somebody's positive, they need to be in isolation at least 10 days. And then there are some other criteria that we look at. We look at have their symptoms resolved? Are they doing any better? Are they fever free? So each person is interviewed prior to being released from isolation. With quarantine, it is from the time you're exposed, 14 days.
Last night, the president said he has now developed immunity now that he has the virus. Is that true?
Well, we would love for it to be true for everyone who's had this, but no, we actually don't know that yet. There has been nothing out there that suggests that there is lasting immunity. In fact, there have been quite a few cases of people who have been reinfected. So what the deal is right now is if you are tested within the 3 months of your previous diagnosis and you're positive, it's not counted as a new case, but after 3 months, then it can count as a new case again.
So I'm hearing a 10-day threshold. I'm hearing a 14-day threshold. You personally, let's say somebody in your office is diagnosed with COVID and they're gone for 14 days. When will you feel comfortable being face-to-face or mask-to-mask with them in a closed setting again?
Well, after the 14 days are up, assuming that they haven't developed any symptoms during that time and haven't tested positive during that time, then they're allowed back into work. Again, we can't prevent anyone from actually having COVID from coming into a workplace or a school or whatever. So the key is in your workplace, you have to make sure that you're doing the prevention measures that we talk about every single week. Everyone wear masks. Everyone stay at least 6 feet away from each other. And that's going to continue throughout the rest of the pandemic. So if you're doing those things and someone comes in and they're positive and you find out later, you should still be okay, because those are the things that are going to prevent your exposure.
The CDC predicts that by the end of October, we're going to have 233,000 deaths, which is higher than the projected forecast back in April. To what do we attribute that climb to?
We attribute that to people not doing the very basic public health measures that they need to do, probably because there is an insane amount of misinformation going on out there. You've seen that it's actually the president of the United States, the Cornell University study says, who is putting out misinformation. He does it every single day, and so does his administration. I just don't understand why. Why are they doing that? I don't get it. Because these measures are not going to change. They're going to be the same throughout the pandemic. And everybody's like, oh, we need to live with the pandemic. Precisely, we do need to live with the pandemic, and that's why we have these measures. We need to do these things, and if everyone did it, we would see a drastic reduction in numbers. It's happened in other places of the world. It happens in states where they do it. It happens in counties where they do it. It happens in workplaces where they do it. It works. So, the masking and the social distancing are not political messaging. I don't know where that came from. It is not, magical thinking. It actually works, and it's been proven to work. And until people, stop playing games with this virus and start taking it seriously, we're not going to get our numbers down as a country, and we're not going to get our economy back operating like we all want it to.
There are several drug companies that are in the third stage of trials. What are the next phases now, or how much time has to elapse to watch people who are in those trials?
You know, I honestly don't know because there's so many trials going on. There's the vaccine trials, and then there's the drug trials for all kinds of things and all kinds of vaccines. So, you know, once you're in phase 3, it has to go on for quite a while. They are looking for two things. They're looking, is it safe and is it effective? Because you don't want to provide a vaccine or a treatment that actually ends up then being worse than, you know, the cure is worse than the illness. So you don't want to do that. But I know that people are signing up to be study participants, and you know, I've signed up for it as well. So it is just one of those things. It's going to have to play out a little further. And despite what the president says that he wishes everybody could have, you know, the treatment he got, that is not going to happen. It's not going to happen. We need to not pretend like it's going to happen, and he needs to not give false hope that it's going to happen, because that is quite a ways off. I would love it if we had that just for everyone, but we don't. So, you know, we have to keep doing the measures that we need to do.
For us lay people, Julie, can you explain a little bit about the difference between developing antibodies to something and developing immunity to it?
Well, I mean, so it's the same kind of thing. You have antibodies to something afterwards. Once you've been infected with something, the question is, how long are those going to last? You know, are you going to have immunity for a month? Are you going to have it for 2 months, a year, life? I mean, you don't know, and it's not something that they can just, you know, magically come up with an answer with. They have to actually, time has to elapse, and they have to see, you know, what's happening with people as we move through this. We're only in, you know, the 10th month of knowing about this virus at all. So how far we've come is completely astonishing, but we've still got a ways to go. And just because it's been a long time and people are bored with it doesn't mean that they can stop what they know they need to do, because that's going to put them at risk, and others.
People who shed the virus, that's the term that you hear if somebody is contagious or even asymptomatic. So once somebody is shedding that virus, is it considered the droplets from their nose and mouth, or is it in our sweat, or how does somebody shed a virus onto someone else?
Well, I mean, they find it in all kinds of things, including feces and you know, but for this, the way that this virus transmits the most and causes the most harm is, you know, through respiratory droplets or through breathing in someone else's breath when they're coughing or talking or singing or whatever. That is definitely the most dangerous. You know, you can still get it from touching something where somebody may have coughed and sneezed on something, getting into your eyes. But really, what is the most concerning is the breathing in the virus from somebody, breathing in the aerosol, or, you know, being coughed and sneezed on, something like that. So that's why the masks are critical.
We are coming up on flu season, and a lot of people have gotten the flu shots. The flu zone high dose has run out at Christie and Carl, which on the one hand is great because people went early and asked for it. On the other hand, people over 65 now are getting the regular flu shot. Is that still something? I know it's better than nothing, but is it still a pretty strong fight against influenza?
Oh yeah, they absolutely still need to get that. I mean, we didn't even have flu zone, you know, a few years ago, but it's still important to get the flu shot. It's going to lessen it if you get it. But this year, I really hope, I mean, it was such a large amount of our population in our county have already taken the flu shot, which is awesome. That's such good news. But also, so they're protecting each other with that, but also the other things that we're doing with the distancing, the masking, and all of that. We really hope to see a very mild local flu season here, so that because everybody's doing really what they need to do. So that's super encouraging.
As you mentioned, everyone's doing what they're supposed to do. We are social distancing, we are wearing masks, we are washing our hands, but flu season is upon us. Is it inevitable that there will be some overlap and that we will see a spike in the symptoms, and then suddenly we're left wondering, do we have influenza? Do we have COVID? I mean, is it inevitable that that will happen?
Well, yeah, I mean, some people will get flu, I'm sure, because not everyone will take the flu shot. And then there could be people who The flu shot doesn't work as well. So it's absolutely, likely that people will get flu. What we're hoping to avoid are serious cases and complications and hospitalizations. But do you know when you first get sick if you have COVID or flu or any type of other viral, illness? Not necessarily. So if you get, fever and the cough and sore throat and the various things that cause respiratory or that show up as respiratory illnesses, it's a good thing just to call your healthcare provider. If you don't have a healthcare provider, a medical home, you can call and talk to someone over at, Francis Nelson Health Center. You can talk to a nurse at Public Health. You can talk to patient advisory nurse and find out if it's something that they want to evaluate, check, because what they're going to probably be doing this year is a flu test, a rapid flu test, a rapid COVID test to kind of figure out which is which what's going on there.
I wish we had rapid tests for schooling. It would be fantastic if we could send kids into school with an immediate response. But right now, some of the schools in the area are in person. Kids, from what I hear from teachers, they're pretty good about the mask wearing, but they pull it down. They touch their faces a lot. They still want to be in each other's face. Are we doing a good job of being careful by in-person school? And are we tracking the numbers of increases for teachers and students?
Yeah, what's happening in most of the schools right now, of course, the big ones are not in. Champaign is not in, and Urbana is not in. But a lot of the smaller schools and the private and parochial schools are doing, a pretty good job of what they need to do inside the building to keep the kids, 6 feet apart and wearing their masks. And like you said, the kids don't seem to, in general, be having that much of an issue with the mask. They just are. Little kids kind of they're pretty adaptable, but it's not as easy, even if we had access to just a ton of rapid tests, it's just not easy to do that in a school. And it also isn't going to prevent an outbreak. You still have to do every single thing that we've been telling you. And a perfect example of why just the testing doesn't work is look what happened to the White House. It turned into a multi-location, multi-day super spreader event. So you can't expect testing to replace the prevention activities.
I'm glad you brought up Capitol Hill for my final question to you. A lot of the senators, and I'm going to single them out, a lot of GOP senators are refusing to get tests. Do you feel that we are possibly moving in the direction of needing a national mandate for tests just because it's, forget morally reprehensible, but it's irresponsible not to get tested if you've been exposed?
Well, I don't even understand that. Again, I think that I know what's going on right now with the Senate. There are people there who should be in isolation or should be in quarantine. You're not allowed to leave your house when you're in isolation or quarantine unless you need emergency medical care. So the fact that they're just not following the basic public health laws that they expect everyone else in the entire country or indeed world to follow is ridiculous. And there are people in the Senate and pretty much everywhere that are high risk. I mean, there are several people in there that are over 80, and we don't know what underlying health conditions people might have. So it's just not a good idea. That whole situation was really a mess because all along you can just follow it through those multiple days, and people who were exposed should have been in quarantine so that they wouldn't be exposing others. And instead, it just went from whatever may have been the initial thing, and it just kept going to more and more events, and more people kept getting infected. And we don't really know where it's leading because apparently the CDC was not allowed to do contact tracing and follow-up. So
I'm glad we live in this community. I'm glad that we have you. I'm really glad that we have Urbana Mayor Diane Marlin leading the charge to keep us all safe. And of course, our producer, Jason Liggett, one of my favorite City of Urbana employees. And most importantly, Julie Pryde, Administrator of the Champaign-Urbana Public Health District. You and all of your staff, thank you on behalf of the community.